I've indicated that the cell is this incredible piece of art that has been around for millions of years and understands more than we'll ever know. And it's something we have to respect, that the cell has the ability to make the decisions in keeping it flexible, in keeping it efficient, in making things work against disease states, against immune problems, against fighting cancer or neurodegenerative issues or anything we want to throw at it. The cell has the capability of adapting and fighting that because it does that every day. Well, I think for us to introduce this concept of understanding that in the cell, there's this organelle called the mitochondria. And a lot of things a lot of disease states end up always coming back to, and genetic issues and things gone wrong in the gene pool and processes of epigenetics and all other things that can influence a cell. The mitochondria is this organelle that is basically, think of it as the battery of the cell. And it's this incredible organelle that has the ability to take in carbohydrates, proteins, fatty acids, and use those in multiple pathways to produce ATP, NAD, which are energy-producing molecules, and to use those to influence other cells and their signaling capabilities, and to kind of control the process of how the cells adapt to everyday life. And it all comes down to this simple concept of redox. And redox is about balance in the cell. And that's really all you have to know about that word. It's a very technical and chemistry-based word, but all you have to know is that when we're seeking redox in the cell, we're seeking balance. And so the focus is really on just influencing or giving the cell the information to maintain itself in a redox state that allows it to function at a homeostatic place of efficiency. It means that the cell doesn't get overreactive or underreactive. It just hums along like it's supposed to in doing and maintaining its work and adapting to everyday life that you present to it. It has to be flexible. If it loses that flexibility in decision-making, then that's when cell signaling can go wrong. That's when redox states can change. So if we know what controls that and how to maintain that efficiency, and we know how that goes wrong in disease states, in immune problems or dysfunction, in cancer or degenerative states, then we can work backwards and focus on trying to improve that cell's flexibility and efficiency. So that's kind of what the focus is on cell function, on redox, on maintaining balance, and just understanding that if we know more about cell signaling and how we can help that cell make its own decisions, it can do it way better than we can. And that's where our focus is today. So let's move on and let's continue to educate you what we do here at the Redox Medical Group.